Dr. Patla, the Surgeon General, Dr. Dabula, the acting head of health, Dr. Anban Pillay, and the representatives of the different departments, DIRCO, Defense, and other departments present. May I also bring the apologies from Minister Naledi Pandor, Minister Mapisa Ngabula, Minister Pegicele. A number of the ministers could not make it to this meeting, Mr. Jojo, and so on. So we just want to apologize on their behalf and indicate that they were supposed to be part of this meeting. May I again also thank you for your huge interest. I know yanking you out of your beds on an early Sunday morning is not a very comfortable scene, but also we would thank you for your interest in this matter, and to a great extent, very good reporting that we have seen that indicated that you have been partners in sharing the information with our public. Now, we just want to give a bit of information, which is an update, but in addition, we also want to indicate since the President has issued the instruction for the evacuation of South Africans from Wuhan in Hebei province in China, we just want to give you a little bit of additional information. We must also say that because this is an evolving process, we may not necessarily answer all the questions that you raise because some of the stuff is still being worked on. We just want you to be aware that we are very keen to share as much information as will be necessary. You will excuse me if I were to take you back a little bit on the history of this whole problem, but we thought that's important just to take you a little bit onto the background on this matter. That in December 2019, Chinese authorities announced the emergence of a novel coronavirus that was a causative agent for an outbreak of a respiratory disease, a very unusual one. It is believed that the outbreak originated in food market in Wuhan city in China, and this was thought to have been of a zoonotic origin, but of course we're still waiting for concrete confirmation. The virus has now come to be known as COVID-19. The symptoms largely are respiratory, which can range from mild upper respiratory infection manifestations to respiratory failure, multi-organ failure, and death. The mortality rate is estimated right now at about 3%, and evidence shows that the vast majority of fatalities are patients who are immunocompromised, either due to extremities of age or pre-existing conditions, that something else was the problem with the patient, and then when they get the infection, then of course their body fails to cope with it. Whilst there are ongoing studies, there's no proven vaccine, and so we learn on this, on managing this problem as we go along. On the 30th of January 2020, due to emerging worldwide spread of the virus, the World Health Organization declared coronavirus a public health emergency of international concern. This sets in motion predetermined global policy implementation that enables the cooperation of governments, the private sector, and multilateral organizations to optimize the response to the spread of the virus and ensure its early detection, its containment in any territory around the world. This includes the ability to strengthen public health systems in territories that are under-resourced. I would like to therefore take the opportunity to thank the World Health Organization for the critical leadership that it has provided. We have been in touch with the Director General as well as the Director inside South Africa as we were managing this particular matter. We've been fortunate that to date there has been no case of COVID-19 inside South Africa. I think it's important for us to underline that, because sometimes when we look at the reports, it's almost like people treat it as though we already are right in the middle of this infection. At the moment, there is no single case. We're just giving you a factual situation. However, as you have heard now, that two South Africans who were crew members of the Diamond Princess ship tested positive for the coronavirus. This is the ship that is parked off the coast of Yokohama in Japan, and we are in daily contact with the embassy in Japan, and the Diamond Princess parked off the coast. So we are in touch with the cruise liner itself and the embassy, but also we've made also contact with the specific citizens from South Africa. So we've got the names, the details, and we've spoken to some of them. Those citizens from the cruise liner are receiving direct contact with our team, as I've said, to monitor their progress. We've been assured that they are recovering, and those two who are on treatment, when they test negative, they'll be free to return to South Africa, because then they would have been cleared of the virus. And so it's all they wait for is treatment and test. When the test is negative, they'll come back. And once they are tested negative, we're no longer interested, they will be coming back as such. However, the others that are waiting to be tested, they will also have to be subjected to a 14-day quarantine, so that thereafter they'll be tested, and then hopefully they'll then be returning without any restrictions. The South African government has worked hard to optimize our state of readiness with the resources and capabilities we have in the event that we should have a case of COVID-19. The multi-sector National Outbreak Response Team, we call it MINORT. Now, that's the team that's represented largely by the ministers and the officials who are here. This team is responsible for tracking and tracing outbreaks around the world, monitoring and analyzing the developments, advising all relevant authorities on the country's response to the outbreak, and ensuring our state of preparedness. This team has been set before. It's the one that's been dealing with the previous outbreaks, the Ebola, the H1N1, the SARS, and so on, whenever, and any other hemorrhagic fevers that have been spotted in our continent. This kind of team is the one that gets to respond when there are those kinds of situations. It's more of an emergency kind of response that we have to deal with. The National Institute for Communicable Diseases had picked on the COVID-19 outbreak, and then the MINORT had been convened twice even before. By the time the WHO met, we had already made several meetings to start to activate our standard operating procedure, to put them in place for early detection, containment, and management of a possible outbreak in South Africa. This included bringing up the capacitation of our ports of entry to be able to screen incoming passengers, especially those from China and other affected countries, and preparing tertiary institutions to be referral centers for the isolation and management of COVID-19 patients, as well as to take advantage of their research capabilities. We did update the public on this issue, indicating that we had actually deployed thermal scanners all over. We've trained people and we've sent people to actually check on the response of our system to people who are coming through. On the eve of the WHO announcement, I held a press briefing detailing these measures, which included the activation of the Emergency Operations Center in the event of a WHO public health emergency announcement. When that announcement was made, our Emergency Operations Center was immediately activated. Many of the media had an opportunity to go and see this particular center just to see of how it's supposed to work. A 24-hour clinician hotline was set up, as well as a working hours hotline set up for the public. The public hotline number is 0800 08000 29999 and operates from 8 to 4. And if in South Africa, if we were to confirm a case of coronavirus, the public hotline would be converted to a 24-hour hotline. So we're just on standby. If there's a case, then of course we start running 24 hours. We're waiting for that, we're ready. These hotlines have been extremely busy, fielding a number of calls from clinicians and the public, and the second line has also been linked to the clinicians' hotline. And in this, the reason why this is the case is that when we send the information out, we've said to our clinicians, our nurses, anything that looks, let's call symptoms, which are severe, even if it might be a common cold, just take the precaution to do the test and refer us for opinion so that we actually don't miss anything. An inter-ministerial committee was formed, as I've indicated, the Health, Defense, Home Affairs, International Relations, Cooperation, Justice, Social Development, Police, State Security, and so on. These ensure that there is coordinated collaboration across different departments, and each is able to directly respond to specific needs that may be required from it. Since the outbreak of our government has issued daily statements with situational updates for South Africa, and we've actually got some of our top specialists actually giving voice messages even to deal with queries that are coming from the public. Sometimes we pick those up in Facebook, sometimes we pick it up in the media where we think that there's something that needs to be corrected and clarified. We deal with it that way. So as of the 26th of February, 121 people have been tested for coronavirus, and all results were negative. On the first week of the outbreak, the number of citizens wishing to return was negligibly low. So in fact, the first time we started contacting our people, we were able to reach the first 34 people who were in Wuhan city. And then, of course, 33 of them didn't want to return. One only was wishing to return. And then we said, okay, we'll keep extending the net until we find everyone. And I think we must be aware that South Africans tend to go to any country without reporting to the embassy. So just to know who is there, it takes quite a while to update. So we've been dealing with this update on a continuous basis. So the first time when the question was raised about whether they want to come back or not, the first 34 said, only one said yes, they would like to be brought back. And we had also considered the situation in China, in Wuhan, and we thought that their precautionary measures were fairly adequate to be able to address the situation. And also we took note of the WHO's advice that no ban on travel and trade should be imposed. And we also were in contact with the Chinese government to look at the extent of their readiness to deal with the problems should any of our citizens be infected. We were quite satisfied at that point that we could actually deal with the situation conservatively, allowing people to be there in China. But we have been in contact constantly with them, with our citizens, as well as with China. But every day, our minority team has been sitting and evaluating new information that arises, and then sending the information for the ministers to look at it. And on a continuous basis, our view has been to take the necessary decisions as the situation arises. So on a day-to-day basis, we've been evaluating what is happening to our citizens and to the conduct of the viral infection. We must commend DIRCO and the staff, as well as the Chinese authorities, for assisting to locate our citizens in China. This work has actually been quite elaborate, because we gave a directive that each and every citizen in Wuhan must be frequently contacted personally, and that their concerns must be recorded. In other words, he must be phoned, and then they must say, this is so and so, how are you, where are you, what's happening there, are you well, do you have any concerns, do you have any needs, do you want to come back, and so on. This was frequently, sometimes every day on some of the people, sometimes several times in a week. So this has been an intense process that has been embarked upon by DIRCO. That's why we really want to commend DIRCO for the good work that they've done in this case. And there's been lots of cooperation with the Chinese authorities in Shanghai, in Beijing, and in the consular offices in Shanghai, to make sure that we stay in touch with as many of our people, and make sure that where we had not enough information, they made that information available. In some instances, government had to intervene to give advice to individuals, advise them. We got them into a WeChat. It's WeChat. WeChat group in China, and there was frequent exchange of information. They would ask questions, and then our officials would then respond and give them advice on the WeChat groups. And then when there are queries that the embassy couldn't deal with, they would come back to us, would get the expert opinion and send them back the advice, as it were. And in some instances, there were those who had special requirements. Some of those, for example, who were having medications which was available in South Africa but not in China. We had to actually make special arrangement for dispatching those medicines so that they can get into China. And the Chinese embassy, here, as well as the Chinese authorities, have been very, very supportive as we actually made this information, these supplies available. Sometimes they raise the concerns about low food supplies, then we'd go back to China and raise this issue, and then China would explain what had happened and correct the situation. And so in all the instances, the Chinese authorities have been very helpful and supportive, and we were happy with the conditions of our citizens. I think it's important to make this point here because, we have been working very closely to look at the interests of South Africans in China, and we have been getting the kind of support that we would really expect from China based on our diplomatic offices in China. In some of the cases, people have now raised issues of personal resources that are running low. Some of them indicating anxiety to return home, and then the requests now started increasing. Now, therefore, government has got specific identities of individual South Africans, their exact location, their conditions, and what they're doing in China. And so we have all of this information. We've always prioritized the conditions of the South African citizens in China. So we've got all of this information. There was a time when we didn't have much of this information in terms of the details, as I was indicating. Today we've got all of those of that information. So I think that the accusations that the government didn't repatriate our people because we prioritized diplomatic relations with China, and the accusations that the government is sending mixed messages, I think that's very ill-informed. It's also mischievous, and I think these are attempts to create sensations and controversy on a matter that I think requires our single-minded focus of South Africans so that we focus on the safety of our citizens. So day-to-day decision-making was what really helped us to decide at which point we want to intervene, and we're looking at a lot of those factors as the situation was evolving. Following the President's directive for the repatriation of asymptomatic South African citizens in Wuhan city, where the epicenter of the outbreak is, such contingency plans are now being effected as a matter of extreme urgency. We've noted that other areas of China do not represent a high risk of exposure to COVID-19, and so the citizens under lockdown in Wuhan have been prioritized. In other words, if you have a South African who is in Shanghai, in Beijing, in some other parts of China, Shenzhen or wherever, and they want to fly into South Africa or want to fly to China, we are making no restrictions there. There are no problems. The ones that we want to evacuate are the ones who wish to be repatriated, who are in Wuhan city, and those who are in the neighboring areas within Hebei province. And this is important because it's not about just telling all South Africans in China to come back. It's about those who are in the epicenter of the infection, where the outbreak is highest and the risk of infection is highest, as well as in the area which has got a lockdown, because a lot of their activities are reduced. Some of them students are studying, they are in their rooms, they have to stay in there. Some have finished, as I indicated. So that's the area we're focusing on. We're not focusing on the rest of China. We're only focusing on Wuhan, and those are the ones that the President's injunction is about. We've been able to ascertain that approximately, right now, the figure keeps changing. Right now, the figure we have is that about 201 South Africans are living in the area of Wuhan, and 151 have indicated they wish to be repatriated. So a few days ago, we had a number which was different. At some point, we had 80, and at some point the number went to 130, and then of course now the figure is 151. And this is based on us calling people every day and asking them, are you still fine? Do you now want to change? Do you want to come? Yes or no? We're finding new people, so and so. We've located so and so in such and such a place, and therefore would like to contact them. And then that's why the numbers keep increasing. 16 citizens have indicated no, they don't wish to return. They are still comfortable and they would like to be, assisted wherever they are, but without having to come back. There was also a South African citizen who elected to be repatriated with Indian citizens who were recently evacuated by the government of India. We're not really involved, except that on the last moment we received a call to say that South Africa have an objection if anybody went to join the flight to India. Well, of course, we didn't have any objection to that, so long as if the individual was going to be put into quarantine for 14 days and be tested negative before they return, we don't have any problem. In response to the plea of our citizen to return, Cabinet therefore instructed the inter-ministerial committee to effect the plans to evacuate those and repatriate those citizens. At this stage, through DIRCO, we're making an effort to locate the remaining 36 South Africans in Wuhan that we're trying to find so that we can just get them to indicate what their situation is. So we're making a special appeal to families who may have relatives in Wuhan to contact DIRCO. I'll read the numbers, but of course I'm sure you'll find it and you might be able to help us to publish it. And the number is 012-351-1754. The other one is 012-351-1756. And then of course we've got an email to DIRCO, which is cicc1@dirco.gov.za, and also CICC2 in the same domain. The repatriation process will be implemented in 3 phases, namely the evacuation, the 1 phase, the quarantine, the 1 phase, and the reunification. Those are the 3 phases that we're going to be focused on. These are guided by the WHO guidelines and the relevant South African laws, policy, and policy framework. So I'll go through some of these phases just to give you a sense. The evacuation is an exercise that will be undertaken by the military in cooperation with DIRCO and the Chinese authorities. DIRCO has got the responsibility, but they are supported by the defense, the military. So working with the Chinese authorities, the evacuation will be prioritized by those particular authorities. All South African citizens from Wuhan city that wish to be repatriated will be accommodated and brought back in an aircraft that will be under strict protocols of quarantine when they come back. There will be a multidisciplinary team on board the aircraft that will be responsible for pre- and in-flight screening and medical care, and all nationals that do not meet the medical screening requirements during the pre-screening phase will be referred to the Chinese health system. A port of entry has been prepared for the receipt of South African nationals and flight crew and medical team. In other words, what we're then doing is we'll have a direct flight. There's a limited time within which this will be executed once they are in Wuhan, and then they'll come back straight into South Africa. We'll create a dedicated channel for this. That means the aircraft, the crew, and the landing base, everything is going to be dedicated and focused onto it. I'm sure every one of you wants to know now, which aircraft and who's going to go there. Well, we will not be able to give you that because the Defense Force is working. They're fairly capable of making this decision, so we have left it with the Defense Force to sort out the modalities of transporting people to bring them here. The other issue is that all the staff, support staff, that will be handling the quarantine process will also go into quarantine themselves. So that is now to seal the whole chain so that anyone who could have been exposed will actually be brought in. We've also, as Department of Health, made a recommendation that when they load those passengers in. If there's anyone that might be requiring any sort of isolation inside the particular aircraft, there should be provision made so that they could be isolated en route coming this way. That is just to add, precautionary measures to make sure that we do as much as possible to stay within the strict isolation procedures and protocols. So that is what we call the evacuation. Then our planners are at an advanced stage on this one. I think we also will understand that once the Defence Force gets activated, there are certain of the activities that fall within the code of the confidentiality that Defence Force issues, military code, will actually not allow us to be making those statements here because of the nature of the operational involvement. The second aspect is quarantine. The very nature of quarantine exercise is to isolate the group of COVID negative people who have been exposed to a high risk environment. Remove them from the high risk of a high risk environment and then allow the determined incubation period to lapse before being integrated into society. Human contact and mixing of groups will be limited in the entire process. Now, this is important also to say to South Africans. The people that we are bringing in are South Africans who are healthy and as far as we are concerned, they are not infected. We only want to take a precaution to allow the tests to be done so that at the period during which the virus should be incubating, we should then confirm that they didn't get infected and therefore they can be released. It's a very important precaution that must be respected because the risk of anyone just walking straight from the high outbreak area into the society is that if they caught the infection on the last day, they've got about 14 days within which we will not see any symptoms, and thereafter, by the time we intervene, they would have probably infected other people. So they are not, as they come here, infected. And I think we need to put that up so that, and I also hope that the media is also not going to be whipping up a paranoia about South Africans who are going to infect everyone in the locality and that everyone is in a particular risk. We just want to handle this matter responsibly. So those South Africans are not infected. They are coming here. It's a precautionary measure that you do under these kinds of situations. So we will therefore be identifying a quarantine facility that meets our requirements. Now, before somebody asks where is that going to be, we are not going to give you the name yet. We must just say to you, the teams have been out there. They've actually inspected 84 sites. So whatever anybody might have told you that they've been here, they've been there, they may well have been. 84 sites. Again, the team is capable of finally identifying the right place so that we can actually use that. But the requirements should be that there will be a perimeter line, which is the outer perimeter that will be guarded by the military. In other words, there should be no easy entrance into the site. Then it is actually considered as a no entry zone and no fly zone. So you shouldn't really be wandering into that area. It's really a precautionary issue. And those who are under quarantine will not be allowed to exit the perimeter, but will be allowed to move freely within the perimeter, although we will be discouraging group meetings. Someone can move around, but they need to stay far from everyone else, and as far as possible, they should really keep into their rooms, because that's what they've been doing whilst in Wuhan, and therefore we just want to reduce unnecessary mixing. Although they come from Wuhan, they don't come from exactly the same space, so they would have come from different parts, so we'd like to just make sure that they are protected. No one will be allowed to enter the zone. Not the media, not the families, not the officials who want to come and inspect from whatever. Only those who are assigned are going to be allowed to be in there. And there will also be a no man's land which will allow the exchange of the supplies of goods. So they'll be delivered to a particular point, and with the necessary precautions and protection, then the others will collect it from that point. So there will be all those kinds of protection. We then want to plead with the media that even if you will find out or you are informed of this particular location, please don't make any attempts to enter the quarantine zone. And maybe may I also just say that if you were successful in entering the quarantine zone, you will not be successful in leaving it. So I think it's important to understand that once there's a need for quarantine, we consider that you will voluntarily subject yourself to the need for a quarantine. But if you didn't, there will be law enforcement to actually encourage you to stay within the quarantine zone. And I think we must understand that it's a very, very serious and sensitive matter, and we really like to ensure that no one really tries to place any pranks around it. The support staff in the facility will be subject to quarantine protocols. The entire quarantine period will be around 21 days to allow for arrival and phased exit. The incubation period is 14 days. We want you to stay until day 14, then we start doing the test and then wait for the test. So within that last week, we're basically just wanting to be sure that we have got the results back. We also want to make sure that we begin to explain to the individuals and counsel them so that when they get to the community, how do we deal with the issue? The real concern we want to make sure we don't run into is a problem of stigmas, where somebody starts getting excited, that there might be a risk. We just want to make sure that this issue is handled properly. Now, there will be legal action taken on those who go against the stipulated regulations of the quarantine requirements. And that's within the law. There will also be medical facilities to be installed in the area so that there will be a way of dealing with those immediately affected or that need attention at the time. On arrival, the members will be on the quarantine. They'll be briefed and tested. There'll be screening that will be done at certain intervals. And should anyone exhibit symptoms whilst in the quarantine, then they'll be immediately isolated. And then if they're found to be positive of the coronavirus, they'll then be transferred to the designated facility within the area where they are. We have indicated that there are about 13 hospitals that are designated, so they will actually be taken there for treatment. Then, of course, should there be multiple cases of coronavirus, then we'll escalate this to multi-isolation system, whereby we will therefore be stricter with the movement, confine them more into other rooms, etc., etc. This, I think, we learned a lot from observing what happened in the Diamond Princess. Some of you would have seen the stories that came from there in terms of really how strictly we need to try and adhere to the quarantine process. So that was the second phase, which we call the quarantine process, as it were. And I want to again appeal to the media that we know sometimes your sources can give you information, you like to break a story, you like to come with something that is not reported by anybody else, but please respect the quarantine line. That issue is very, very important. It's not about you, it's not about your story, it's about the safety of South Africans. And therefore, that's why everyone is going to be involved in this. Beforehand, they will actually be asked to declare that they will be willing to stay for the protocol period. And those will be landing into the aircraft. One of the preconditions is that they'll have to agree to go to quarantine. If you're going to be evacuated, you must first agree you're going to be agreeing to the quarantine and move on. But of course, if there's any kind of possibility of disruption of the quarantine requirements, there's a law to protect us on that. We can even take the matters to court. So there is a way of managing such a situation. We don't believe that South Africans will want to go that route, because all of us are aware we're trying to really make sure we do the best for ourselves and our community. The last phase is the reunification. And we assume here that this will be an incident-free quarantine. So the final day of the quarantine will be denoted by members being testing negative of the virus, and therefore they'll be given counseling, and they'll be given leave to depart. And then we need to, therefore, amongst the team we'll have social workers. They must also interact with the families, just to make sure that everyone understands that yes, they might have been in the area, but they are not really posing any risk. And so that will then go into the whole program of disinfection, of decontamination of all the items that were associated. And we believe that there are good enough protocols for that, and everything after that should be acceptable. Now, that really deals with the issue that the President has given us an instruction on, and we have indicated to you the situation about the Diamond Princess as well. But let me just comment briefly on a few other areas. Whilst it can never be possible to predict what will happen in South Africa if the virus were to be introduced in our territory, I think it's a useful exercise to look at what's going on globally. We continue to monitor global events, developments, and we're in touch with our embassies, and we also talk to some of the clinicians and some of the researchers who are in these particular areas. We are concerned that when we first reported this matter, there were only about 4,500 cases reported, largely in China. They were mainly in China. Today, the coronavirus has spread to 50 countries worldwide. And we think that the consequences are beginning to be devastating, because you are now beginning to pick up deaths in countries away from China, and this number is rising. So we are in touch and receive twice daily updates from some of the embassies of the ones that we have targeted and we're working with. In particular, South Korea has got a rapidly rising COVID-19 cases. We've been in touch, in particular there with the embassy and the South Korean authorities. They have over 2,000 cases reported. The last we checked, it was about 13 deaths. And the city of Daegu is the one that seemed to be the epicenter, which is about 300 kilometers from Seoul. And Seoul itself has got about 65 cases reported. The rest of them are with South Korea, with Daegu. And it is felt that there was a religious group that had a huge gathering, and quite a bit of infection could have also spread from that group as they broke from their conference, and then they started spreading. We do have South Africans in this particular area, and we are actually aware that the South Korean government is taking specific steps now to impose certain precautionary measures, closing down certain buildings and also moving people into some of the areas and so on. We keep monitoring this. We think it's important. At the moment, we haven't issued any specific bans on any matter. We're just saying anyone who comes back into South Africa, we must actually widen our net of actually asking more questions, so that we rely on voluntary disclosure at that level. Iran is an area of concern, seeing that they had about 141 cases and a high mortality of 19 of those. Now that's actually pretty high considered mortality if you look at the numbers. 141 deaths with 141 cases and 19 deaths, even involving some of the very senior leaders in the area. I think we are also concerned, and we're just watching what's happening. We understand that both Algeria and Nigeria have one infection each, and those who are infected have got no history of travel to China. In fact, from what we have found, it seems that these are people that travel to Italy. Italy already reported in the past few weeks that they had actually a third generation spread from someone who was in China and then they infected a relative, and then the relative seemed to have also infected a health worker. These are just the stories that we read from the media, indicating the changing pattern of how the disease is manifesting. Reports of death in the USA has also come out, and there are also individuals infected that have got no record of any known person with COVID-19, which means now we're beginning to see COVID-19 prevailing in communities that have got no link whatsoever with China. I think we have to all get ready, as there is no country that has a formula to prevent the coronavirus from infecting its people. But I think we must make a bit of a distinction. Up to now, we're dealing with the issue as an emergency, wherein there will be a case coming in, and then we have to deal with that and so on. Like we have dealt with the previous episodes of Ebola, hemorrhagic fevers, H1N1, and so on and so on. So that is a situation where you have a case and you all activate emergency measures around it. And when we say we're ready, we're talking about that. We can still deal with any one of the cases if they land up in South Africa. That's the readiness that we've been talking about, and that's one issue. But I think in the long term, the WHO has also raised the point that we must now prepare for a coronavirus which would be endemic in different countries, literally all countries, and so. But I think the fortunate part is that there's quite a lot that's been led within the very few weeks with the treatment regimes in China, with the approaches that they've done. I think that the way they've dealt with it has also been quite instructive. There are a number of research areas that need to be done. For example, the question of how soon after the patient is tested negative of the virus does it stop being infectious. Common experience suggests that once someone tests negative, there should be no possibility of transmitting the virus. So that's how we understand, and that's the approach. But I think we do need to now look at that. It's important to get research into that direction, because it's got implications for those who are returning, having been treated already for the virus and so on, and to what extent the immunity can be built in the individual to avoid reinfection in the future, to what extent right now what has been said is that there has not been any evidence of a rapid mutation of the virus which will suggest that the same immune system that dealt with the virus when it was under treatment might be affected, might not be effective if it comes back again. So these are just speculatory areas, and I'm just saying we can't answer those questions. We're just saying that we're interested in all of this. But we think that the manner that China has managed the outbreaks has many lessons for the global community, and they've indicated what mistakes we need to avoid and what kind of treatment has been effective, seeing that China has treated the largest number of people with HIV, with coronavirus, which is 80,000 patients. Approximately 32,000 have been treated and released from hospital in China, and around 46,000 that are still on treatment, with about 2,900 deaths. So already you're going to, I think, get to a point where there would have been more people who are released from treatment, who are cured of the infection, than those who actually still have it. And that's actually very good news, because as we look at how the disease behaves, all of us are going to be taking lessons from China. And relatively speaking, the mortality rate is 3%. It's a lot of people, but I think the mortality rate is actually not so high, as it were. But of course, we have indicated that the normal flu, the influenza virus, has got a much higher mortality globally. So, furthermore, as I've said, that the numbers of recoveries in China, is actually beginning to exceed new infections that they are recording per day. So, this is a positive picture for us. So, I think that To conclude, we need to watch and bear in mind the highly dynamic nature of the global coronavirus phenomenon, and we are also working already on looking at how the system in the long term should be able to deal with this. So we are already conducting and convening a large number of our specialists, clinicians, virologists, specialists in infectious disease control, and so on, so that we can look at dealing with the issue now more on a longer term basis, because I think we're going to soon be out of emergency mode, and we have to deal with the resilience of every system to be able to deal with the problem. Our level of vigilance continues to be at the highest level in the wake of the WHO announcement of coronavirus as a public health emergency of international concern. We will also continue to issue situational updates in the form of media statements, and also we will also keep updating the public in terms of what needs to be done. I think also it's important that the people that we are talking about, who are dealing with people who are healthy otherwise, and who are either in school or doing business or on holiday in Wuhan, and therefore their dignity is also important. We should really not begin to deal with their situation and create a sense where they must be hounded now and be treated as some kind of individuals that must be viewed with suspicion. And I also think that at this point it's important for us to commend China and also thank them for their cooperation and for the way that they've been sensitive each time we raise issues and concerns from our citizens in China. They've actually been able to respond. And we also believe that, as I've said, that China will continue to give lessons to the whole global medical community about a lot of things that have been lessons from the managing the infection. And as we are here today, we think that it's going to be important for us to give you regular updates if there is anything new. But I think it's going to be a matter of time that all countries will ultimately have to face, the coronavirus being something that's discovered in the country at some point, and all of that basically means that we must just begin to adjust to that. But I think, as many of the past epidemics, it becomes important to say that medical technology advancement and advancement in research has always been very handy in dealing with this. Already the discussions are about issues of vaccine, issues of the most effective antiviral agents to be used, and so on. And I believe that we all can take lessons out of this process. But what we really believe is going to be our biggest enemy in this issue is to allow disinformation, fake news, creation of doubts when we send out messages, and questioning them with no basis with no scientific basis, and people who are going to create a sense that people are not being told the truth, therefore people must be all worried. It's going to be a matter of concern that we will actually be self-defeating, and therefore hence our plea that this whole hammering on South Africa is not ready. South Africa is not ready. I don't quite understand where that comes from, because we've actually had a number of outbreaks that we've been ready to deal with and contain, and we've been able to deal with them. And if people were raising the issue based on already the effect of or the impact on the infection in South Africa, even before we have the first case, now the reports are, well, South Africa is not ready. Yes, there are challenges in the health system, and the challenges in the health system don't mean that people aren't being treated and cured. It doesn't mean that we will not be able to respond to the situation. But I think, as we have seen, a number of countries, we have learned quite a lot. There are some countries that evacuated their citizens, and they are sitting with infections in their countries. And so, everyone does what they think is best for their situation, And there's no one that I think has got an expert view as to how to manage this situation. But I think it's important to learn from one another. I think it's also important that when you come across, as members of the media, you come across issues that need to be brought to our attention, we need to also look at that. And we'll continue to monitor the situation on a day-to-day basis. And as we do so, we have the interest of all South Africans at heart. And we actually believe that with the team that's going to be doing this work, they'll successfully execute it in a way that will make sure that the best outcomes, we get the best outcomes for South Africa. I'd like to stop at that point and want to say that if any of the colleagues would like to add at this point, we should feel free to ask my colleagues to add, because this is a multi-departmental, inter-ministerial effort. It's not just one department. I think just the indication is that DERCO and Department of Health are in the forefront, and the evacuation is DERCO, but supported by the military. The quarantine is Department of Health, supported by the military, and also the rest of the other services, as I've indicated. So all of us are going to be working on this together. Thank you very much.
Thank you very much.
No, it's
Thank you, Minister. Any of the Minister, Deputy Minister, thank you. Anybody else from the panel before we proceed to the question and answer session? And Joko? Thank you very much. Right, let's take our round of questions. Oh, thank you, sorry. I'm sorry. Rounds of questions. I have 1, 2, 3, 4, 5, and I'll come to you. I'll start with you in the next round of questions. 1, 2, 3, 4, 5. Okay, Griselda.
Oh no, sorry. I don't know that part.
Good morning, everyone. I'm Griselda Lewis from SABC Television News. Minister, thanks for that update. I think the biggest question at this point is when those South Africans will be evacuated from Wuhan. Just moments ago, in fact, I received a message from one of the concerned mothers who asked, where is the briefing? So I told her to turn on the television so that she could listen to you, and I think she just wants to know, when is her son coming back home? You've highlighted, the conditions that South Africans are in Wuhan. We want to know when. Is it going to take a week? If you don't have a date for us, a week, a month, what is the current time frame that you can give us? I know you've also mentioned that this is strictly for those in the epicenter in Wuhan at this point. Again, you've spoken about Seoul, which has a rising number of COVID cases. Would the South African government at some point consider assisting others in, very dangerous territories in some of these countries, perhaps to repatriate them as well? I know that this would be a mammoth task if you have to take everyone out, but would you reconsider that? And 84 inspection sites thus far. You've not identified exactly where, and I can understand possibly, Minister, why you wouldn't want to say where they will go. But those 84 sites that you have inspected, are you sure that you'll have a site available by the time you decide to bring those South Africans home? Thank you very much.
They mustn't answer too many questions.
Gaupalele Palaitile from Jacaranda FM News. Minister, just to add on to what Griselda just asked, will they all be coming at the same time, or will it be different times? Like, will you be able to get them all to come at the same time back into the country?
Apologies for not standing up, Minister. I've got all the cameras.
No problem.
CCTV, China State Broadcasting. Minister, on this there is a cost. If my figures are correct, on the 5th of February in the Hebei province, they had 2,500 new cases a day. On the 27th of February, they had 300 cases a day. So China has quite possibly got control on this. Wouldn't these people be better off staying in China since they appear to have the edge on how this infection is spreading? This comes across as 80 million mentioned in the media of the cost of this process of bringing 132 people home. Is that well spent money at the end of the day? Thank you.
Good morning, Minister. Barry Bateman from ENCA. You referred to the repatriation of people in the epicenter in Wuhan. But I think you suggested that people in Hubei province and surrounding the city might also be repatriated. I've seen a letter that was sent yesterday to the presidency from a family of somebody who is in Xinjiang, which is about 50 to 80 kilometers away from Wuhan. They're saying that they haven't been identified to be repatriated, but they themselves are subject to the same level of lockdown being in the Hubei province. Are they also eligible to be repatriated by our government? What should they do if they are? And just please provide clarity on that. Thank you.
Peter, right?
Yeah. Minister Peter Fabricius from the Daily Maverick. If I may, in a follow-up to Jill's question, the Chinese government was very insistent at the beginning that it was unnecessary to evacuate. And you told us a moment ago that you've been constantly evaluating the situation. You started off by thinking it's fine to leave them there, and then you decided against. So I wonder if you could give a sense of what changed your mind. Was it just the appeals from the family, or was there some concern about the actual conditions and so on of the people there? The other thing I wanted to ask you, you're talking about a 14-day incubation period. My understanding from what I've read, and you're the Minister of Health, obviously you would know better, but is that there's uncertainty if 14 days is enough. There's some people who think the incubation period should be longer. And just a practical question, if I may. You said that when these people arrive on the planes, the South Africans in Wuhan, if they are infected, if I understood you correctly, they won't be allowed on the plane. Those who are not infected would be. But then you seem to be referring to an in-between category. You said some people might be allowed on the plane but in greater isolation. So I wonder if you could just clarify that. Thanks.
Thank you.
Thank you very much for all the questions. I'll answer some of them, and maybe the colleague can also might like to add. The first question is when. We were asked by the President to start the process immediately. The inter-ministerial team has given the planning team that's going to execute this within 7 to 10 days. They must have completed the task. We will not give the specifics because they will have to work on it, and when everything is done, they must proceed. They don't have to come back for another mandate. So within 7 to 10 days, they must have all of this done. This will allow for all the logistics, the contracts, the negotiations, the payments, the supply chain, whatever that needs to be done. So that's the approach. We would consider assisting others in other areas. We're talking about Daegu in South Korea and so on. At the moment, there's been no such a consideration. I have said that we every day receive information and evaluate the situation. So we can't predict anything, but at the moment the decision has not been taken to repatriate anyone else. Will the site be ready at the time? We have given clear instructions. We have got reports that the arrangements are advanced, and so we believe that we will meet the targets. When people come back, there will be a place ready and all of that. So will they come at the same time or different time? At the moment, we believe that all of the people will be brought at the same time. The number we've given you is because we wouldn't send a flight or an aircraft to fetch people that we don't know. And we're not going to get people to come back who have not previously reported that they are processed for that. They've got to show us their passport, they must prove they're South Africans, and they must agree that they'll go to quarantine. They must know where they are. They get the direction as to where they must be so that they can be conducted at a particular time and so on. You can only do that if you are well within the system and you are known. So we expect them to all be collected at the same time. Hebei reported 2,500 infections a day, and that number is down. Indeed, that's the information we have, and we believe that there's been a huge change. I think it's a kind of sense of an inflection of the trend of the epidemic. It's basically showing a downward trend, as it were. It still remains a very difficult disease to deal with, and the question is being asked from different ways. What we're not going to say here is that there's a problem with the treatment that China is giving that made us feel that people must come back. There isn't. We're not sitting here and saying, China has failed. No, we're not saying that. We're simply saying South Africans are in touch with us, and when they say to their government, please, we'd like to come back. If they said we didn't want to come back, we said, okay, we won't come back. But in terms of our understanding of how the disease behaved, it was not an immediate risk that would have actually necessitated us to immediately evacuate. At that time, at this point, it's not so much that we have changed our minds. It's basically that at the time, we did say, we spoke to some of them and we said, what is your sense? And then they were not really rushing to come back. And slowly, as the numbers, and some people as they hear, oh, there's a possibility, others are saying, no, we also want to come in. And so the cost of bringing South Africans back to South Africa, it's a cost that the country must bear. It's not something that we can say, we can't spend so much to get South Africans back. They are entitled to come back to South Africa if they wish to. And South Africa, part of our responsibility is to look after the interest of South Africans out there. The cost, the figure that's been put up there by the media, let's leave the speculations at the moment because, we are not going to give you an exact figure of anything. We got the teams working. Once it's done, we'll tell you how much it cost us. It might be, a figure that will keep changing as the situation begins to change. So we don't want someone to say, oh, okay, we gave you a wrong figure, now we're giving you another figure, as it were. No. I think that it's important for us to just say that we will do everything to make sure that we take into account the constraints, the financial constraint that the country is in, and the fact that there's a need for South Africans to be brought back to South Africa, and that is it. So the question of the nearby provinces, we have not factored those in here. We have said those who are in Wuhan city and those who are in Hebei province, if they wish to be brought into this, they'll also have to contact the center that's going to be coordinating this, and that's the way. Now, as much as there might have been a lockdown in the nearby provinces in China, we do understand that the real epicenter of the infection is Wuhan. So all the neighbors might take precautions, but the real epicenter is Wuhan. And so we have only identified Wuhan city and Hebei as the main area, and we have said earlier that those who are in other parts who might be wishing to move, then we can just listen to what they have to say and evaluate their situation when they do. Unfortunately, they reported to the media. If you give them the numbers for DERCO, at least we can deal with them directly. Then we know what is the best way to deal with their situation. So we'll have a better response to that kind of situation. China did say that it was not necessary to repatriate. We also said it was not necessary to do that. But that was on the basis of how the disease is manifesting and how the treatment protocols and the prevention measures were being embarked upon. That was also before South Africans said, no, we'd like to come back. And now that they've said so, we're going to prioritize them and bring them back. So it's not so much of a change of mind. It's a matter of taking the decision and as the situation evolves. That's what we have. So if tomorrow we do something that we never announce, it will be because that will be, in our best judgment, the best that needs to be done. 14-day incubation may not be enough. while I did highlight a number of areas where research will still help us to clarify issues, so we won't worry about that. All we can say is that in this case, we have said that they will be in for 14 days, we'll test them, and we look at the next few days, up to 21 days, to see how to manage their situation, and then, of course, we will then release them after that. But I think that too much is unknown about the virus that we should be able to answer all the questions. I think each time you ask the questions, we must also get our researchers to look at that, what experience are we getting. But I'd like my colleagues to also come into the issue. Thank you.
No, thank you very much. No, I'm just taking the question, the last question from Peter. Peter, medical science is not a mathematical science. In simple language, the human body doesn't react like you do in mathematics, because no two people react exactly in the same way to an infection or any disease process, be it cancer, high blood pressure, etc. We never react the same. So when science talk about the incubation period, it's an average. We had Ebola. The incubation period was 2 to 21 days. 2 to 21 days. Meaning some people 2 days after infection will show the results, but others after 21 days. This was calculated due to experience. We had listeria. The incubation period was between 1 and 90 days because people react differently. Now we have got Ebola. Science has set the incubation at an average of 14 days, and we are working on that. It will never be exact, and that's why you're talking about no disease has ever had an exact incubation period. It's always a range, and now we're working on 14 days. And the fact that the department has added an extra 7 days is insurance, and we think it has to work like that. Thank you.
Yeah, I think just to add on the Minister's response on the issue of the number of people who asked why the change of mind. You should consider the fact that when there is a lockdown, people are firstly expecting a shorter period. You're optimistic that the first week, the second week, the third week, obviously the longer it takes, the levels of stress and frustration, and that's why then you get more and more people requesting to come back, simply because of the fact that the period of the lockdown, as the epidemic has been, a challenge for a longer period. More and more people will then lodge a request to come back, and as a government, you have to be sensitive to that. So that's why the assessment in the beginning, expecting that the lockdown will be a shorter period, and we took a particular view, also advised by our citizens. But as the period gets longer and more people, request assistance, that's why, as a responsible government, there had to be a change of approach, and as approved by the President. Thanks.
Thank you very much. From a social development point of view, obviously, we do come into the picture because when people return, there's a whole lot of work that needs to be done from a psychosocial point of view, and therefore we need to be ready, and we wouldn't be ready without participating fully in the planning processes. That's the first thing. The second thing is that we are responsible for our citizens, irrespective of where they are and why they went into any particular country. Our responsibility through the Department of International Relations is to always respond to the needs of our citizens, and it is for that reason, therefore, that when we got the request, we needed to act and act as quickly as we possibly could. I think what is also important here is for us to make a call to our citizens overall, that if there's a family anywhere that has people that we are not aware of, it becomes their responsibility to get in touch with government. We've given all the necessary numbers and everything, and also to make a call to South Africans in general, by the way, that whenever they travel to the world, we do have embassies almost everywhere in the world. It makes life better for you when you travel to a country and you make the embassy aware that you are in that country, because you just never know what might happen. So for us, it's a call to the nation that you're free, you travel to wherever you want to travel, you do your businesses, you do your tourism, you do your visits, but it's always important in the pocket or in your bag, have the necessary information so that if anything happens, you'll be able to make a call, and the embassies are always there ready to help. Thank you.
Yeah, I think just to underline that point, sometimes it's very easy to come back and say, oh, why the government didn't respond on an issue. This one on the Diamond Princess, no one actually told us that there were South Africans in there until the day the quarantine was supposed to end. And the question that came to us, will we accept them in South Africa? And I said, but we didn't know they were there. And then in the process, of course, we had a very good cooperation. In the process, we were able to give them advice. This is step by step. This is what you should do. This is what we should do. Right now, we're very comfortable with them. In fact, there's even a doctor on board who's a South African. And we're now linking up with them. It's so much easier if the communication is open, that we know how to deal with a changing and evolving situation. So I think the point is also very important about us informing our embassies where we are, so that we are able to respond quickly when there are situations of distress.
Thank you very much, Minister. Let's go for the second round of questions. And we'll start in the front. 1, 2, 3, 4, and I'll do 5 that side because we've had a turn, then we'll take another round. So 1, 2, 3, 4, 5.
Okay. Hi, I'm Cindy Siwatwala from Newsroom Africa. Just one question that I'd like clarity on. I know that I'm asking a lot of details, but where exactly are they going to be landing? Is it going to be Atterkloof? Is it, even if you don't draw me into the details, but is it where exactly?
Okay, two behind you. Okay, well, there were these, and I'll come back to you when we do this round.
Good morning. My name is Lazarus from Critical Media. Minister, my question is, how do you screen? Do you screen everyone who comes into the country, or from specific countries that are affected? It was reported that about 2 French nationals who tested positive, who visited Egypt, were tested positive. And Mamelodi Sundowns, last night they were playing in Egypt. And Egypt is closer to Iran. Iran with this number of affected cases. And we have SA Cricket. But, I mean, it's not far from Egypt, the Iran. And looking at SA Cricket playing with Australia and with 5 affected cases. Thank you.
You are asking in general, everybody who comes in from wherever they come from, not necessarily from the center of the time.
Morning, Minister. My name is Arisa. I'm here from Media 24. You touched briefly on the designated hospitals in the country and the readiness thereof. We did some research at the Pilanami Hospital, and there's only 47 beds available for quarantine and about 4 beds for critical isolation. And also it has been deserted, the Pilanami Hospital's quarantine camp. It has been deserted, the place has not been opened. So we just want to know who will be manning this hospital, who will be manning this quarantine center should there be an outbreak. And then in terms of the Klerksdorp hospital that was also designated, a large number of the personnel at the hospital actually found out from the media that they were designated to be a COVID hospital. So there's also a lot of personnel at hospitals that don't know exactly what is happening. So how will it be communicated to them? Has it been communicated to them? And then we would also like to know, a shortage of masks has also been reported, not only at these facilities, but across the world and across the country as well. So how will you ensure that the families of the people who have been quarantined, who are coming from Wuhan, have enough masks, and that the country has enough masks should there be an outbreak? Thank you so much.
Morning, Ministers. Marijke Vermaak from AFP. Thankfully, my colleagues have asked most of the questions I wanted to ask, but just in terms of logistics, what my colleague there asked in terms of when these guys land, I agree. Can you tell us if it's going to be like a public airport or are they going to a military base? I understand you might not want to say why or where, but should people be concerned when these guys are coming back? Because that's the reaction. I know they shouldn't, but can you just kind of explain why people should be relaxed when these people come back? Because if you're looking at the backlash on social media, I'm also speaking to at least 3 of the South Africans that are in Wuhan, and they are legitimately frightened about what the backlash will be of them coming back. They're seeing these things on social media. Their families are concerned. They are concerned about it. And then just in terms of logistics, can you just tell me, are we the first African country to bring people back from Wuhan? It might be a silly question, but I'm not sure. Are we the first African country to repatriate guys from Wuhan?
No.
Okay. Who else was there, just as interest?
Okay.
So, thank you.
Thank you.
Thank you. Ntakwana Ngajani, Eyewitness News. Minister, we understand from South Africans that EWN spoke to who are in Wuhan that the lockdown might actually be lifted on the 10th of March. This is the reports that they're getting. So if there's such a short space of time left, is there really a point in South Africa embarking on this exercise?
Thank you very much.
Okay. All right. Ms. Twala, we did say we are not saying where they will land. So we want to repeat, we will not be able to say that. We can only say to you that that falls under the military. So the military will decide where they land. And we also don't think it makes any specific difference because no media will be welcome there. I did suggest that if there is any landing and people break the protocol line, it will complicate issues. So I think we must try and manage it like that. But if it does become announced or the military does announce it at that point, maybe we'll then talk about it. Right now, everything is in the planning and they'll be finalizing it and they'll be moving it from that point. But when that landing happens, it should not happen in a place where you've got a busy, civilian population and everybody moving around so that there's no sense of pollution or contamination. That's what we want to take care of. So at the moment, we're not giving that specific landing base. So, but if military believes that they want to announce that at a particular time when they know and they have confirmed that they've got, it's up to them. We'll leave it at that. Then the question by Lazarus about screening. The way we're dealing with the screening, we're just dealing with the basic precautions. And the basic precautions, we ask people questions, particularly those who have come from China. That was up to now the issue. Right now, we're basically asking the questions now. People who would have had contact with COVID-19 infection, we hope that they will disclose that they would have been and therefore that they will cooperate. The fact that there's one case in Egypt does not make Egypt a dangerous place. You see, China has had so many more deaths, even though they were outside Wuhan city. We don't consider it as a dangerous place. If I can just give you a sense, if you compare the infection that happened in the Diamond Cruise, it will probably come down to 1 in 20 people. But if you compare with what has happened in Wuhan, it's 1 in 1,200 people. So the risk of contracting the disease is not quite the same. From a distance, it sounds scary. And Iran has got a small number. The last we saw was 140 people were infected out of a whole population of Iran. Just that they've got a very high number of deaths. The last we got was 19. Now, what you are raising is a common concern. You know, it reminds me of a story way back in 1977. A research was done why the tourism to Nairobi, Kenya, dropped. And when they asked people why, they said that's because of the riots in Soweto. So sometimes a far off distant place looks like it's very close to one another. So we don't look at it that way. We just ask if someone has been in contact, and then we then will take further details and go and test them. But otherwise, we look for simple symptoms, and then we deal with it. In fact, I was saying to the colleagues, people will land in South Africa, and we will focus on China. But as Nigeria and Algeria has noted, people would have come from any other parts of the world. Now, are you going to start putting a restriction on the 50 countries? It's not possible. It's not practical. Even if you did, the point that was made by Minister Mzwaledi is that the behavior of the infection is such that you can't always have 100%, a certainty as to how it's going to happen. You will find, like they found now in the U.S., people who say, no, I've never been to China. I've never been with anyone who's got a COVID-19 virus. I've never been with anyone who was coughing like you're describing. I don't know. This is what, but they find the virus. So this is human contact, and therefore you can't always tell everything and then prevent everything. That's why we keep cautioning that, we put these simple and obvious and basic facts to say, this is what we're looking for, this is what we're hoping that people must be informed about. And then we get quizzed on the minutest and remotest possibility. It's not impossible, but we're not sitting here saying that we've closed everything. We're just simply saying this is what is happening, and that's all we're doing. Now, Media 24, you've gone to do research on the hospital and who will man the hospital. We actually have people trained in the hospital to deal with that. And so even if you may not have found them when you went around talking, but they are there. The question of staff members not knowing that they are designated is a matter of us intensifying the information. It takes a bit of a while to filter. And so we'll keep moving. Now that you've raised it, it was raised the first time. You'll say, oh, but people are worried about it. Yes, of course they are worried. And there will always be gaps. And when you point it out, we're going to go back and try and close the gaps. And the importance of what we're saying is that we are aware now that media has been to some hospital and the people said they didn't know. We must now back to we've got the Department of Health here. They must go back. Let's make sure that people know, they are aware, they are alerted, because they must be the first ones to suspect and then refer to us. So we'll take care of that. The question of masks, well, China has ordered as many masks as there are possibly available. So I think that if China might be struggling to get masks, every other country must expect that at some point they'll have that problem, because it's the same pool of manufacturers. We have made reservations for some of the necessities, those particular kits, so that they are available in case we need to respond. And we can't say that there are as many as what China would have wanted, we can't say that we can't run short of them. But right now, our understanding is that we can respond, because we're dealing here with an emergency situation where we're not seeing 80,000 people here. We're dealing with a slightly different situation. So we do have, we've made those kinds of preparations. But at some point, if the demand for the world use of masks increases, we hope that the manufacturers will see the opportunity and also match the demand. The other issue that is being raised is why relaxed? If people are coming back, there will be backlash. But that's why really we actually hope the media is going to help us. There's no need for people to be suspicious and create a new sense of enmity with people who are coming back from some of the countries where they would have come from. It's actually short-sightedness to create paranoia and sensation and create a fear and really, because the stigma is a matter of what information we are allowing people to get. If we create an impression that this is something that is a big risk for everyone, if you've been into quarantine, then of course we're creating a problem. What we are saying is that once you are treated and you are negative, there shouldn't be a problem with that. I even said earlier that there's a lot of research work that needs to be done just to make sure scientifically proven transmission trends with someone who's testing negative. So, seeing that you've already identified a possible backlash, we would like to ask you to work with us to make sure that we actually fight against any backlash and any stigma. A few countries have evacuated, in Africa, Ethiopia, Rwanda, I think Mauritius, and a few others, Madagascar, yeah. We may not be accurate, but there have been a few that have evacuated, and we respect everybody's decision. Oh, okay, yeah. We've got a few, we've got Morocco, Algeria, Tunisia, Egypt, and the others came later, the ones that I spoke about. So there have been some that have evacuated, but we're not motivated by the fact that other countries have. We're motivated by one issue. South Africans have asked to come back. Simple. South Africans have asked, please, can we be brought back? We're actually going to help them to come back. That's really the reason we bring them. The nature of the spread of the infection is such that we have to keep monitoring it, and we can't say don't stay in China, you're at risk. It's not factually correct. You may have a risk anywhere now in any of the 50 countries. So I think it's important to put that point. The lockdown might end on the 10th of March. Yeah, that would be good news, but it hasn't happened. And in fact, South Africans, right now, we're talking about them in a lockdown. And right now, we're talking about South Africans who have been directly contacted and they've indicated the desire to return. And South African government's responsibility is to support them in their desire to return. We did say that in our previous presentation that there was that expectation that there might be people might return to work on the 10th of March. The Chinese authorities actually extended their festive period for a while and then started saying people must come back to their places of work, but I think they've also encouraged them to give themselves 14 days of quarantine voluntary in those areas. In some of the areas, they've also encouraged them to work from home and so on. So there are those precautions that China has taken. In our case, if the lockdown is eased on the 10th of March and the Chinese authorities feel that people can be free to get back home, at that point, we'll evaluate that and we need to look at how we deal with the situation where people might be coming back with no specific restriction. It's the same like other countries in Korea, in Italy, in the US, anywhere where people can come back from those countries and come back to South Africa when they were not in an epicenter. And so the risk still remains with that, but we can't say that there's any specific action that needs to be taken. We don't consider it a waste of money. We think that right now we must respond as our South African citizens are requesting and deal with it from that point.
Minister, maybe just allow me to respond to this issue of not being ready. I'm not sure whether it's a media culture or generally a South African culture, never ever to believe that we are ready. It looks like the same script is just dusted off every time there is an outbreak elsewhere. Same script, as far as I remember. In 2009, we had H1N1. We were told many times how unready are we. We then have Ebola in 2014. We had been told so many times that I was even, called to Parliament at that time, more than 3 times to assure Parliament that we are ready, because the media was continually saying we are ready. Then we had Zika in Brazil. We were hammered again about not being ready. Now it's the coronavirus. Now with Ebola, until the epidemic dies down, we were hammered that we are not ready, despite the fact that South Africa was the first to send a mobile laboratory to Sierra Leone. And half of all the infections that happened in West Africa were diagnosed by South Africa. Half. Take the number of infections that were there. Half were diagnosed by South Africa, but we were told we were not ready. All the armies of SADC came to South Africa for training, to be combat ready for Ebola. All of them were trained here. All the ministers of health came here, for a briefing, and we were told we are not ready. South Africa is one of the only 2 countries in the whole continent that has got what we call a BSL-4 laboratory, Biosafety Level 4 laboratory. That's the NICD. The only other one in the whole continent is in Egypt. And those are the only laboratories that can deal with very serious pathogens, like you are talking about, H1N1, Ebola, Corona, and all that. That biosafety laboratory is recognized by the World Health Organization. But because of this I don't know whether it's self-hatred or self-undermining, even during listeriosis, people did not believe NICD. The company went to an extent of getting a private laboratory in France just to come and confirm the same thing that NICD scientists have been saying. We've got scientists in this country who are world-class, who are respected by the world. I don't know why we keep on undermining ourselves and keep on undermining the country. Lastly, when you get ready for these outbreaks, it doesn't mean when the outbreak is no longer there, then you destroy everything. The readiness that was there during Ebola is still left. For instance, during that time we bought a lot of what you call protective clothing. They were bought for all these hospitals that were choosing. They were never used. They are still there. They are still there. They were ready during that time. They are still even ready even today. There were people who were drilled during that time. They are still there. The NICD center that was established during Ebola, it was just rejuvenated. It was still there. So I don't want us to keep on believing every time, crying, no, we're not ready. The Pilonomi I'm hearing for the second time, unfortunately. During Ebola, a member of parliament jumped. When I was speaking, he said, I've been to Ebola. I've been to I've been to Pilonomi. It's not ready. I said, honorable member, tell me, when you say they are not ready, what did you see? What did you go to look there for? What were you going to look for? That will tell us the hospital is ready. The honorable member did not even know. But he was talking emotionally that, no, I've been there, nothing is ready. He didn't even know the details of how to make a particular hospital ready for an outbreak. So I'm just appealing that let's stop undermining the capacity that the country has got to deal with this type of things. And stop believing that people are lying when they stand in front of you and tell you this. And stop believing that our scientists know nothing. Only scientists elsewhere in the world know something. We South Africans don't know. It's very wrong. Thank you.
Yeah, I think our concern would be that we haven't got a case of coronavirus infection. We haven't lost anyone, but there are countries which have got huge resources, that have got more cases, that have lost individuals, unfortunately. But the attitude we create with our own community, with our own South African public, is that South Africa is not ready when there's no basis whatsoever to actually even make that statement. But because I want to read it in the media, they'll actually say, yeah, the media say we are not ready. Now we say, but why do they say so? But this is managing infectious diseases. You can be as ready as anything, you can still be undermined by the nature of the spread of the infection. And so you can't be said, if you are ready, that means you can't lose a patient. That means you can't get anybody infected. So I think that I do somehow wonder if we have too much of a sense of people wanting to see South Africa fail. That's why you have to be always having to answer things that are not having any specific basis. So I think we need to just walk along together. And where you see that there are areas, there are weaknesses, we find if you point them out, we'll do our best to try and correct them. But this whole issue of discouraging the public to say your country is not ready, your government is not ready, it shouldn't border towards fear-mongering where we just want to frighten people. I think that the issues are serious. People must be well informed, and people must always know that on an epidemic or an outbreak such as this one, it doesn't really depend only on government. It depends on enough knowledge being shared with the people so that people's behavior will help us to contain the infection. That's really what our request would be, that let's work together to make sure that South Africans have enough knowledge to be able to deal with the situation.
Thank you, Minister.
Surgeon General, yeah.
Oh.
Thank you, Minister. I think I need to say that the team that is around the table here, it's a multi-sectorial, multi-departmental, and also a multidiscipline type team. The essence of that is to make sure that South Africans who are abroad are taken care of when there is a need that arises. And the second purpose is that we are around the table to make sure that South Africans at home are also safe. So as long as we can understand that, I think we will march along the correct path. The involvement of all of us is basically to support the Departments of Health and together with the Department of International Relations and Cooperation, purely because this is something that is happening across borders. And again, I want to say that defense is also part and parcel of that supporting of the structures of the Department of Health. Now, the team that is doing the planning in respect of the execution of this task is at a very advanced stage, and as such, divulging some of the details of what the plan is going to be in terms of its execution is really going to compromise the effectiveness and the accuracy of the execution of the task. With regards to the issue of where the aircraft is going to land, whether it's going to be a military base or it's going to be a public sort of facility base, airport, that again is in the hands of the team that is doing the planning. However, I think we need to reassure South Africans that the purpose of all this evacuation is more about responding to what South Africans are saying, where they are, and the second thing about it is our interest is the fact that we're not really wanting to import the disease per se to come to the Republic. And therefore, if we all understand that as a multidisciplinary team, our approach is nothing else but safety. Therefore, the issue of when we're actually going to do the execution is also the one that is going to be the one that determines safety and accuracy of the operation. So I need to just make that quite clear. Thank you very much.
Thank you so much, General.
Can we ask the Acting Director General of Health to also make a comment?
Thanks, Minister. I just want to provide some clarity on both Pelanomi and Klerksdorp Hospital. Myself and Mr. Naidu personally went to the Free State and did an assessment of their readiness and the number of beds, the staff, etc. So they're all very much aware. They have enough equipment, and the staff that need to be responsible for this are aware of what they need to do. The NICD has come up with a checklist of all of the things that must be in place when they receive a patient. Very much what Minister Motsoaledi was talking about during the Ebola time. And so all of these hospitals are aware that they must do this. They've come back with checklists of what must be in place. There are teleconferences between the NICD and themselves in order to make sure that if a patient is identified, that they are fully ready and know how to handle that patient. So there are protocols in place about how the patient must be dealt with, etc. So I think it's important to be aware that this is controlled as well in terms of oversight. On the issue about the screening, when people arrive at the international port, for example, OR Tambo, officials from the Port Health Services board the aircraft and they screen everyone on the aircraft using a thermometer. People then arrive within the arrivals area, and within the arrivals area, they are then temperature scanned for a second time. Anybody who comes from an area that is considered to be high risk, they then complete a questionnaire where we do a further assessment of those individuals, and in some cases we then refer that to the NICD. And on a daily basis, there are individuals that we would consider to be high risk, and those are then referred to the NICD so that they can then do an assessment on those patients before we refer them, or passengers rather, before we refer them. So every day on a regular basis this happens.
Thank you. Minister?
No. No, I think we're fine. Just to say, in the past we tried to make a separation between normal screening, where we just pick up anyone who's got symptoms and we screen them, and what we call a suspected case. Suspected case must have a history of contact with someone who's got the virus, or has been already admitted, or has been in the area where there is a high incidence of the infection and is exhibiting symptoms at that point. So we have a particular catalog of issues that make us define it as suspicious. So if anybody's got landed up and is just feeling, has got a temperature, a fever, and is sneezing and coughing, but they just came from, Bloemfontein, they didn't come from somewhere else, anywhere. We don't really say that they are a suspected case. We just want to make that distinction, because suspicion, in this case, a suspected case is where everything else makes us feel that they would have actually got an infection. from the particular side. So that's the distinction we'd like to make. Thanks.
Thank you, Minister. I think we should look to wrap now. Any further absolutely burning questions? Last round, one. Are you covered, ma'am? You wanted to get a question?
Yes.
You're covered. So, okay. Sorry. Okay. So we've got one. Any other questions? Otherwise, we're closing. Two. Oh, all right. I've got two, and then we wrap. No more burning questions. Okay. Thank you very much.
Hi, Honourable Ministers. My name is Mathilde Boussiou. I'm a French journalist for the French newspaper Le Monde. I just wanted to have more precisions about the screening of international travelers. You mentioned health authorities going on board of planes to screen passengers. Does this apply to every plane, planes coming from China, from other areas? And also, what about Italy? They have like more of 1,000 cases now. Do you have specific focus on the travelers coming from Italy or not? And maybe also France, because we have more than 100 cases now. The other question, very quickly, is some observers have noted surprise to the very small number of cases we have on the African continent. And so there is this idea that maybe we might have underreported cases. Is it a concern for you? Is it something that you look into, investigate? What is your analysis on that? And could this lead you to upgrade the screening procedures?
Thank you. One more question.
Sorry, Minister. Comments passed on the news recently, it says it's not if it's going to arrive here, it's when coronavirus is going to arrive here. You appear to have a lot of measures on the ports of entry, but there still seems to be a feeling by the South African Medical Council that it's coming. Coronavirus is a winter-driven condition. We are going into winter. China is coming out of its winter. We're going to see the hemispheric change. What is in place here when it comes to South Africans? If a mask is costing 25 Rand, if you can get one, because maybe now at the moment it's kind of where if you're healthy, you will actually probably survive the virus. We have inherent health issues in our country. Perhaps now's the moment to say what you are going to do for as we go into the winter, as we face this virus, please.
Thank you very much. That wraps the questions from the floor.
I understand.
Mr. Zulu.
Responding to the issue about our concern in the African continent and the few figures, we're very happy that we've got very few. We're very happy that we don't have as many Africans. That's a plus for us. But that does not necessarily mean we should not be in contact with the rest of the continent. By the way, President Cyril Ramaphosa is now chairing the AU, and therefore the connection and discussion with other ministers of health and all others in the African continent, it's of importance for us to continue that engagement. But I'm hoping that I wouldn't understand it in the sense that it would be saying, why Africa should you have less? You actually should be having more. You should be having more because you this poor continent, you this struggling. I'm happy if I'm understanding you rightly, because if I understood you the other way around, it wouldn't be a very good thing for us. We're happy that we have less, and we actually don't want to have more. We have, as Africans, across the board, and may I say, the concerns for South Africa go out to the entire continent. That's why we always say as South Africa that we do not live in isolation. Anything that happens to the African continent is of major concern to us as South Africa, and we'll do everything we can to connect and make sure that whatever experience that we have, even in the terms of planning as South African, we must be able to share. We've got neighboring countries, and SADC obviously is of major importance to us. So whichever way we manage here We also know that other countries in the African continent will be looking at how is South Africa dealing with it. Is there support that we can get? We've got, as Minister Mzwaledi said, we've got the best scientists. We've got the best scientists in the entire continent as far as I'm concerned. It's just a question of coordinating and making sure that people work together, because we want that the continent to be free of any form of disease, and we have to work together as Africans. Thank you.
Thank you very much. I think it will also help us as a country to realize that at moments like this, you'll have differences of opinions, but you must also choose who has got the final authority. The statement that was said there was never said by the Medical Council. I'm sure the Medical Council, we mean the Health Professions Council of South Africa, which is a statutory body. It was made by SAMA. I listened to that very well, which is a union. Yes, it was made by SAMA, South African Medical Association. Yes, it was said by the president of SAMA. I've got nothing against it, but at a moment like this, we have got authority, and I want to insist again. The authority on all infectious disease is the NICD, the National Institute of Communicable Diseases, which, as I said, is the only BSL-4 laboratory in the whole of Africa, together with one in Egypt. The only two, I mean to say, biosafety level 4 laboratory. When we talk about biosafety level 4 laboratory, the others are level 3 and 2 in the continent. Ours is level 4. When we say biosafety level 4, it's a laboratory that is allowed by the World Health Organization to handle very heavy, deadly pathogens. Not any, like this coronavirus, etc. They are not tested in any laboratory around the world. The US, for instance, big as it is, has got only 13. And the fact that as a small country we have got one, please respect South Africa. Please. And it has also been declared as a reference laboratory by the World Health Organization. So when you are faced with infectious diseases, please listen to what they are saying and listen less to what everybody else is saying. I still remember during Ebola, there was a gentleman in KZN. I even wanted to understand what is authority, who wrote an article outlining how Ebola, that people are lying, this Ebola is going to be like bubonic plague of Europe in the 1800s, which killed millions. I remember that article very well. And I was wondering, who is this person? What authority do they have? What expertise do these people have when our scientists, who are declared by the world as such, are not saying such a thing? So I'm just saying, while we can't stop freedom of speech and opinions, but do know that we have got a central area where we refer when we want to know what's happening about infectious diseases. And it's the NICD, the National Institute of Communicable Diseases. And the world respects it, and it has been given that respect by the World Health Organization itself.
Thank you. The issue that Minister Mzwaledi is referring to, indeed it was raised by President of the Medical Association. As far as I would be concerned, it's a statement that basically you can interpret it in many ways, but earlier on when I was presenting the statement, I said there are two ways of looking at preparedness. The first is to deal with a disease that's an emergency. Somebody lands from somewhere and has got the infection, it's a new infection, and therefore it requires a particular immediate attention. And I said we have got 13 sites, we're ready for that, we'll deal with it. And then I said there's also the issue of looking at the long-term prevalence of the coronavirus, as no country has got a formula to stop the virus from getting into its own citizens. That's about a long-term preparedness. Now, and I've said there's no country right now that can say we're ready for a long-term preparedness. But we are going to, as I said earlier, pull together all the top specialists, the clinicians, the specialists in infectious diseases, the virologists, epidemiologists, and all of them to look at what should we be looking at in preparation for a future where this would be an endemic virus where you can pick it up anywhere. That is something that no country has done. It's something that all we have is just to give the information. And if we have got media that will be able to support as we give information to say to people they must take particular precautions, that is, I think, the best weapon that we will have. There is no other way of preparing for a future other than learning from what has happened in other countries. And all we've got is about 2.5 months of a coronavirus infection. So we can start speculating and make many comments about it, but the reality is that we have to, this is now globally, every country has to start preparing. And we're going to keep taking lessons from other countries as well. The most important thing is to actually help our people to understand that when they get symptoms, they have to seek help, and that our medical and health worker teams, that if they have got severe symptoms, they must seek a second opinion through our hotlines, and that they must also feel free to take the patients and get them tested so we can immediately exclude the presence of this virus. That's why I said 121 people have been tested in the past few days. That's basically what we have to increase. So with more respiratory infections, we might end up having with more people being tested. That's really a precaution that we want to take. But the issues of cleanliness, hygiene, people washing their hands, and when you cough, you use a tissue. When you sneeze, you use a tissue. And all of those things are quite important, as it were. And so those are the things that we're going to encourage our people to do so that you try and keep yourself warm and avoid getting a viral infection, an influenza infection, a flu. All of those things are going to be important. But we must do so in a measured way that makes people understand that we are dealing with a possibility that the infection can arise anywhere, anytime, but that we will also be there when it arises to be able to deal with it. It's important to say that if any one person gets infection and we find out, we'll be able to deal with such an individual. But when we deal with the future, you need a whole resilience to be built into the system and as we move forward. So it's something that everyone is actually looking into. Now, the second question is that we basically are treating all the countries with the kind of caution where we basically ask people who would have been in those countries to declare if they've had any exposure to the virus. Right now, the lockdown is in Wuhan and Hebei. That's where the highest cases have been reported. We will focus on to that because we've got a clear basis for it. There are a number of cases that are arising from South Korea. I indicated Daegu. I indicated the mortality in Iran and so on. But that does not mean that we must suddenly cancel trips there, stop planes and everything. But it also means that we are aware that you could come from France. You could be actually the one who bring the infection. You could come from Italy. You could come from anywhere else. But when we do that, we're basically saying our system is to do the screening. The preliminary screening that gets done on everyone who comes into the airport. And we want to just check for the preliminary thing that could be indicators. And so we do that with everyone. We have not isolated Italy. We have not isolated France. We have not isolated the US. We have not isolated Iran. We have not isolated Japan. And I'm not sure if I'm answering your question properly, but I'm not sure why the 2 countries specifically when there are 50 countries that already got. So, but we're just saying we're watching what's happening everywhere. Now, your question about Africa, yes, Africa has got 3 cases, 1 in Egypt, one in Algeria, one in Nigeria. The processes you undertake to diagnose one is the same that you use to diagnose 1,000, 2,000, 80,000. It's not different. Already these countries have demonstrated that they can diagnose one case. As to who begins to think that they are underreporting, I think we're beginning to get into prejudice. Because you cannot have a situation where countries have repatriated their citizens, they've found that they've got an infection in their own country, they've got more people that are infected, now then it's a fault of Africa. Africa hasn't counted properly, that's why they don't have cases. They just don't have cases. They will come, but they're not there. But I would have a serious challenge if there's going to be media sponsored view that basically begins to make African people to be more suspicious, to say your governments are not counting properly. It's an indictment, and I think it's unfair, it's incorrect. So if now there's going to be a media sensation to say, well, America has got so many, China has got so many, Africa is undercounting, on what basis do we make that statement? The laboratory in South Africa tests for most of the countries in Africa. There wouldn't have been anyone that we would have missed. Now, who's undercounting? Is it South Africa that's doing the test? Or is it the fact that the distribution of the infection is unequal throughout the whole world, as random as any disease can be, and therefore we take it that way? Are we having people who are less trained in Africa? Are we having less experienced clinicians? Are we having less experienced, less equipped laboratories? What is this suspicion about Africa? The issue is very simple. The disease arose from China. Why is China, the rest of China, not having as many cases as Wuhan? That's because the disease came from somewhere. Because it came from somewhere, where it came from, there are more cases. Where the infection spreads, there will be more cases. Where there is no infection, let's not start casting aspersions. And I think that we need to really take exception to an allegation that Africa is undercounting when nobody can actually prove to us that, in fact, there are cases that are hidden somewhere. There's been lots of stories about all sorts of fake news about China's got millions and millions of people who are dying and all of those things and so on. But the figures that we've got have been checked by WHO. But anyone here who's got any suggestion that there are cases that we are not discovering, for some reason, it can only happen in Africa that you don't discover the cases, but you can find them if you go to Japan and other countries. I think it's unnecessary because we have got the same scientific community, the same kind of this thing. What you might have is a problem of once the diseases are in the particular areas, the conduct might be different because of various socio-economic situations, the strength of the health services and so on. But undercounting, really, I don't think that we must actually start creating a new sense of suspicion. I think it's not correct. It's the same as this idea of saying, well, we're not ready, South Africa is not ready. But they don't even have a single case. And this thing of always creating suspicion is the same, whether you're saying South Africa is not ready, or whether you're saying Africa is not ready, or whether Africa is not ready. It's actually casting aspersions to Africa. For some reason, there must be something wrong here in Africa. I think it's not right. And in this case, when there are cases, they will be reported. So Africa has been the only one that had Ebola. They were never hidden. They were never undercounted. Why is it suddenly now an issue that South Africa can't be this? Until someone came from Italy, Nigeria didn't have a case. Until somebody came from Italy, Algeria didn't have a case. Now, can we explain why there are 19, 20 deaths in Iran when they've got only 140 patients? We can't. So there's a lot we don't know about the disease, but let's not cast aspersions on a country or a continent simply because the disease pattern is coming out the way. When we get a report and somebody comes back and they've done a research and they say, well, Africa, we've discovered so many thousands of people that were underreported. There's scientific basis, of course, we will accept that. But I think when we're going to start by creating an image to the public of you can't trust your continent, you can't trust your government, we think that you are actually abetting the spread of the infection because you are making people to be suspicious of any information that they get, and we've got no basis for it. So I think that we must deal with it on the basis that we've got 3 cases counted. If it's 3 in Africa, it's 3. If it's 20, if it's 21 in another country, it's 21. If it's 2,000 in South Korea, it's 2,000. If we have got basis to prove that, in fact, in South Korea it's more than 2,000, fine. Until they've counted and showed us that, we don't say that they've undercounted. So I think that we must try and create interesting angles, but we must know that we're also treading on a thin border between creating a disinformation as when we're actually trying to find out what the truth is. Deco?
Comment from Deco. Thank you.
Thank you very much. Chris Chetty from Department of International Relations and Cooperation. Regarding the statistics which Minister has been speaking, just to say a little more on that, the number of cases that are being reported from all our diplomatic missions across the board in the world, they are constantly giving us an update on these figures. So whatever we are getting from those missions, we are recording it. So we've got officials that are in our missions that are constantly monitoring the situation and are giving us daily updates on what is going on, in particular in China, where we are focusing. But as was indicated earlier in the Minister's briefing, we want to urge the South Africans to please make contact with DIRCO in terms of family members or South Africans that they know that are in China, in particular Wuhan city. We've given contact details earlier on in the press briefing statement, but if you didn't pick that up, it's available also on the website www.dirco.gov.za. So we are, and I see that this press briefing has been quite effective, because as we were speaking here today, the numbers that Minister has given to you has increased by 13 already. So this press briefing has been effective. So we're relying on the media, relying on the message to go out that South Africans that are there in China should register. And in particular here in South Africa, family members, friends could also give this information out to the family members so that we could get an accurate information. So when we are ready to repatriate, we can have all South Africans that are in the affected areas repatriated back to South Africa. Thank you.
Yeah, just to say, we do have, of course, you've got the internet that actually gives you the figures in every country. All the countries that have got cases reported and deaths are all recorded. And I think it's very unfair to single out the African figures and say that there's undercounting when we're taking them from the same report. I think that we must just work on the basis of one set of statistics. WHO verifies and confirms this is what we've got, and we go by that. And if there is any concern, WHO is working with us to always indicate if there's any additional steps that need to be taken to deal with this situation. So I think we must just remain rest assured that no country is acting alone here. Everyone is trying to benchmark with the rest of the countries, particularly at the WHO level. Thank you.
Thank you very much. Thank you to all the ministers. Thank you to the rest of the panel. Thank you to support staff. This press briefing is adjourned.
Thank you.
The minister.
Thank you.